Hello,
Yes,
I am Dr. Bishas. I am a doctor of this clinic. May I confirm your name and age, please?
this Miss Sarah, 42-year-old.
Okay, so how can I address you?
Sarah, it's fine.
Okay, Miss Sarah, I got letter from your GP saying that you have cough for 9 months. Is it right?
Yes,
I'm going to discuss about your condition and I may also examine you. And all the information during your discussion will be remain confidential. So is that okay for you?
sure.
So can you please tell me in more details what is happening with you?
Yes, doctor. It has been a long time ago. It is 9 months. I was very fine before that. Then I started to have cough. This cough started with me and continue for several days. At first, my GB expect that from that a side effect of the Captopril I was started a few months ago. But even after I stopped the Captopril, the cough continue until now. And until now, I am suffering.
I'm sorry to hear that. Can you remember that? Did it start suddenly or gradually?
Suddenly,
And did you ever had cough before this time?
no, I don't remember.
Okay. And when the cough started, how long it persist?
But, it is all day.
Okay. And do you think that it is increasing in severity or increasing in frequency?
Yes, doctor. It was started like it is increasing in severity day by day.
I am sorry to hear that. And can you tell me that when before the start of the cough, do you feel any uneasy sensation in your throat or in your
No,
mouth? Any easy,
no,
any something coming out through the back of your nose?
no,
Any pain?
no.
And when the cough start, do you feel any pain or anything else?
I have discomfort from the cough.
Okay. And have you ever produced any phlegm?
Sometime I have there is some mucus coming with the cough.
Can you tell me the color of that?
It is like whitish color.
Have you noticed
Clear,
any?
it's clear.
Okay. Have you noticed any blood anytime?
No, never.
And can you tell me that along with this cough, do you have any shortness of breath?
Yes, doctor. I feel more day by day more short of breath. Even now, I cannot climb the stair.
Sorry to hear that. I am coming to the shortness of breath later. And with this cough, do you have any runny nose,
No runny nose.
any fullness in the ear,
No,
any uh, lumps or bumps around your neck?
no,
Okay. Any chest pain?
no.
Okay. And have you noticed any variation of the day when you feel the cough more in the daytime, at the night time, in the evening time?
It is more in the night, doctor. Even I cannot sleep very well. I feel tired all the day because of that.
Okay, it is more at night. Can you tell me
More at
that
night.
is it after lying down or is it after sleeping?
It is when I sleep. Sometime I wake up with cough.
I'm sorry to hear that. And can you tell me that do you feel more cough in the evening time or late night like that?
What the when you mean when I sleep? I feel more cough. When I lie down for
And
sleep.
okay, I understand. And have you noticed that anything coming out through your mouth?
Like what? Food?
Any food? Yes.
No.
Any uh, any sour taste in your mouth?
I have a condition called acidity in my stomach. I have reflexes and I have even bad taste in my mouth.
And for how long?
This long time, maybe 1 year.
Are you taking any medication
Ah,
for that?
yes, I take Gaviscon and it helps a little.
And you said that food coming out, you have acidity, and you have bad breath,
No food, but there is acidity.
and any fluid or liquid coming out.
No fluid, but I have reflex, acidity, and uh, the sore pain because of the.
And sitting down make your cough better.
Yes, this even the advice of the doctor that I should raise my head when I sleep.
And did it help you?
Yeah, a little.
Okay. And may I know that how much this condition is affecting your life?
As I told you, doctor, I because of the cough, I cannot sleep properly at night, so I feel tired all the day,
I'm sorry.
and it's affecting my job.
I'm sorry for that. And have you ever noticed anything that makes your cough better except sitting down?
My doctor prescribed for me inhaler called spray called salbutamol, but it doesn't help me much.
Okay. And you said that you have shortness of breath,
Yes.
and for that is for 9 months or more.
This maybe 6, 7 months like this.
And when do you feel shortness of breath more?
When I do exercise, when I do exertion, when I climb the stair.
You feel more shortness of breath.
Mm,
Okay. And have you ever noticed any swelling in your legs?
no,
Any shortness of breath after lying down?
no.
Okay. Have you ever needed to wake up at night due to shortness of breath?
Due to cough, not shortness.
And have you noticed anything that makes your shortness of breath better, like resting or anything else?
Rest, rest.
Only rest. And how far you can walk without any shortness of breath?
When I walk regularly, there is no problem. But when I go hill or stair, I have shortness of breath.
I am going to ask you a few other questions. Do you have any headache?
No headache.
Any headache in the morning?
No,
Any changes in your vision?
no,
Any redness in your eyes?
no,
Any rash anywhere in your body?
no,
Any changes in the skin?
no,
Any funny color changes of your fingers?
no,
Any joint pain?
no.
Uh, how about your appetite?
It's fine.
And may I know that have you noticed any changes in weight?
No,
Uh, do you know how about your weight? How
it is like 61 kg.
do you have any hot or cold preferences? Any weather preferences?
No,
Any racing or pacing of your heart?
no,
Any lumps or bumps anywhere in your body?
no.
How about your water work?
It's fine.
And how about your bowel habit?
Fine.
Okay. And any weakness at any side of your body?
No.
Okay. Can you tell me more about your food habit? 10 minutes past.
I take all food, no issue, but some food causing more acidity in my stomach, so I avoid it.
Okay, you can get it. And do you have any past medical condition or any disease in the past?
As I told you, I have raise in blood pressure, and I received for that captopril. It was replaced by amlodipine later, and now it's okay.
Okay, and for how long did you take captopril?
It is like 2 years. It
Okay,
was started 1 year ago, but stopped after I have the cough.
okay, that is you took that for 3 months.
Yes.
Okay, and do you have any other condition? Any history of
No.
asthma, childhood asthma?
No.
Okay, and may I know that do you take any other medication except amlodipine and inhaler salbutamol?
As I mentioned to you, I Gaviscon also, Gaviscon and salbutamol and amlodipine.
Any other over-the-counter medication?
No.
Any herbal products?
No.
Okay. Do you have any allergy to any medication?
No.
Any of your family members have this type of condition?
My mother has asthma. Otherwise, no.
Any other disease that runs in your family?
My father has had a heart attack.
I'm sorry for
That's all.
that. And, is it okay if I ask you a few personal questions?
Okay.
Do you smoke cigarette?
No.
That is fine. Have you ever smoked?
No.
And do you drink alcohol?
No.
That is fine. May I know that what do you do for a living?
I am shop assistant.
And what does your job involve?
As I mentioned to you, I have I'm tired during day. It affect my job.
Do you need to expose any certain chemicals or any products, any cotton products or any specific products?
No. It's,
Okay. Have you ever needed that?
no.
Okay. And you said that your job is affected by your condition. For that, I can contact to the occupational healthcare department and they can find a suitable job or they can relocate at your job. Will it be okay for you?
Fine.
May I know that do you have any pet at your home?
I have cats.
Any other hobbies do you have? Gardening or anything else?
Swimming.
Have you noticed that is there any changes in the variation of your symptoms at the weekend?
No. Same.
Okay. And is it okay if I examine you now?
Fine.
Okay, I want to see your pulse.
Okay. Pulse 95.
Okay, then I want to see if there is any rheumatological changes, any finger deformity, any joint swelling.
Normal.
Okay, and I would like to measure the blood pressure.
140 over 80.
After that, I would like to see the eyes,
Normal.
anemia, redness,
No.
any baking of nose,
No.
microstomia,
No.
any telangiectasia.
No.
In the oral cavity, I would like to see any rash or any scar mark.
No.
Okay. Then I would like to auscultate the lung.
Okay. The lung air entry is equal by lateral. There is some prolonged expiration, but no wheeze, no crepitation.
Okay. And, then I would like to percuss if there is any dullness.
No dullness.
Okay. After that, I would like to listen the heart if there is any murmur or not.
Nothing.
Okay. And after that, I would like to see the ankles for any pedal edema.
No beta edema.
Okay. And at this point, may I know that what is your concern?
Doctor, did you reach my problem? What is my problem?
Yeah, actually, at this point, there are certain possibilities that can affect your condition, and I am not quite sure. I need to run some test, some imaging test, some blood test. After that, I can give you the best explanation. And at this point, my thinkings are that you have a condition, maybe from suffering from asthma, or more likely you are suffering from a condition called gastroesophageal reflux disease that is uh, affecting your uh, windpipe, so that you are having a frequent cough. Do you get me?
Yes.
And
Do
also,
I ha- mm,
yes, please.
do I have a big infection?
Mm,
Bug infection?
at this point, may I know that do you have any fever?
No fever.
Okay. Then bug infection is unlikely, and sometimes it is possible that even after stopping the captopril medication, there can be some long time effect. The cough can persist for long time.
Mm. Even I stop for a long time.
Yes, it is a possible that even after stopping the medication, the effect can persist for a quite long time.
Mm. Doctor, is it related to my travel to India? I'm originally from India and I traveled last year to India. Is it related to my travel?
Okay, actually, your symptoms that you don't have any fever, or you don't produce any flame, or you have not any uh, uh, you don't have any other significant findings on the chest examination, so it is unlikely, but this is also a possibility.
Okay, thank you, doctor.
Time up.
So what is your diagnosis?
For this lady, I have a few differentials that it can be a case of a gastroesophageal reflux disease, then it can be a case of asthma, then it can be a case of ACE inhibitors induced cough.
Mm. And what is the top differential?
My top differential is gastroesophageal reflux disease.
Okay, what are you going to do for the patient?
For this, I would like to educate and counsel the patient about the condition, then some non-pharmacological management lifestyle management, as reducing weight. Also, she is on a good weight, and then giving her some lifestyle modification advice, like raising the weight, uh, and limiting the consumption of tea, coffee, chocolate, and beverages. Then some pharmacological managements, like giving her some omeprazole, proton pump inhibitor, then prokinetics, and then also involvement of the disciplinary team, a respiratory physician, and also involvement of the gastroenterologist for the better outcome, and also involvement of the occupational health therapist, as her job is affected by this condition.
Investigation.
Yes, I'd like to go for the complete blood count to see anemia and white blood cell count level, then inflammatory markers after the liver function test, renal function test, and random blood sugar level and urine for routine examination. Then I will go for the cyst X-ray, though it is normal, so repetition is unlikely to be helpful. And then I will go for uh, uh, 24-hour esophageal pH monitoring, then invasive test like upper gastrointestinal endoscopy, and also ECG.
What what else? Are
Uh,
you going to do chest X-ray?
Cyst X-ray is done and it is normal. So repetition will not be helpful for this lady.
Okay. Is there a possibility that she has sarcoid?
Yes, there is also possibility of having sarcoidosis, though there was no other significant no other signs or symptoms of sarcoidosis.
Mhm. Okay, and what is the treatment?
Uh, for this treatment, like pharmacological managements like proton pump inhibitor, then prokinetics like metoclopramide, domperidone. Then there are some surgical managements like uh, esophageal endoplication. Actually, cannot remember at this time.
If not responding to medical treatment, we refer to surgical.
Yes.
Mm. Okay, fine. So do you ask patient if she has any noisy chest?
No, I forgot.
Do you have the travel history?
No, I also forgot that. That was very important.
Did you ask patient about what against asthma here?
Okay, but for against asthma, there is some that is shortness of breath is present on exertion and present almost all the time. There is asthma is more likely at late night or in the morning time, and also uh, patient don't have any precipitating factor for asthma.
Are you going to do spirometry and
Yes,
responsive test?
I will go for this parameter. I forgot to mention that.
Did you ask patient about the technique of inhaler?
No, I forgot.
Oh, that's all. Okay. Otherwise, your performance was very good. Even this miss point, it's very little and doesn't affect the final diagnosis and the first diagnosis, which was very good and very targeted. And your investigation and treatment also completed. Thank you for your performance.